like to begin by acknowledging the traditional owners of the land on which we meet on today. I would also like to pay my respects to elders past, present, and emerging.
As stated by Sarah Novak in 2022, one of the biggest emotional challenges you'll experience with a premature birth is leaving your baby in the hospital once you're released. Within this presentation, we will address how immense this challenge really is and what population groups require additional support. According to the World Health Organization, a premature baby is born before 37 weeks of pregnancy. Each year, 18% of newborns are admitted into the NICU, with 6% staying in hospital for more than 2 weeks. This separation of a mother and her newborn can have a drastic impact on the mother's mental health and how she perceives her baby. During our presentation, we will delve into 3 key issues relating to leaving a premature baby in the hospital. Our first topic covers issues related to the attachment and bonding of a woman and her hospitalized newborn, and how this can affect the mental health of both a mother and baby. These concepts of attachment and bonding will then become more specific and refined as we delve into the hardships of mothers in rural and remote communities. For these women, leaving their newborn in the hospital could mean driving hours on end to visit them. Finally, we will discuss the disruption that leaving a premature infant in the hospital can have on cultural traditions. When highlighting these issues, it will become clear the influence they have on the transition to parenthood and how, as midwives, we can play a role in supporting these women.
Infants are born dependent on their parents. From the first contact, newborns undergo social, emotional, and cognitive growth shaped by the bond or attachment relationship with a parent. Attachment is a clinical term used to describe a lasting psychological connectedness between humans, whilst bonding describes the feelings, thoughts, and behaviours of the parent towards the baby. Doug Graver discusses the importance of attachment between the mother and newborn in the first few weeks. They state that as human babies have no autonomy to act, they are dependent on the people surrounding them. Without these attachment interactions early on, women who need to leave their babies in the neonatal intensive care unit, NICU, or special care nursery may not develop this level of attachment immediately. As highlighted by Doug Graver, babies need the availability of their mothers for the first 3 to 4 months. However, they miss out on this time while in NICU. Post-birth, a woman is ready to support her baby in various ways, which include feeding, nappy changing, swaddling, etc. However, when a baby is in NICU, parents miss out on the opportunity to engage in these activities due to the constant disruptions of medical intervention for baby. On top of this, parents are separated from their baby, which creates feelings of helplessness and reinforces the lack of bonding which gets to form between them. Therefore, whilst a baby is in NICU, it is detrimental that mother and baby can still have time together to bond. Skin to skin, also known as kangaroo care, refers to the practice of holding an infant in an upright position, skin to skin, on the parent's chest for a period of time. This is a method used to influence a newborn's attachment behaviour and give both parents a chance to bond with their baby. Doug Graver highlights a concept known as the first 1,000 days. This was created to prevent developmental disorders in newborns. However, having a baby in NICU can interfere with this, posing risks for developmental disorders occurring during the neonate's maturing. This, among the other factors discussed, may pose issues for parents in their transition to parenthood, as key stages of baby's development are hindered. The aforementioned issues may also give rise to women experiencing postpartum depression. It has been found that 20% of mothers with infants in NICU experience depression, typically exhibiting worse symptoms than mothers of well babies. It is vital as midwives to recognise symptoms and provide support for these women. Communication between the parents and midwife is key because we are able to provide updates, reassuring parents as to the health of their baby. This communication allows parents to feel involved and supported in their baby's care. Furthermore, parental involvement creates positive outcomes for physical, cognitive, and physiological development of NICU babies. This involvement can counter negative effects of the 1,000-day concept by reassuring parents that despite their baby being in NICU, their development won't be hindered. Regarding continuity of care, this model stems around the woman-specific care, but it has been found that a family-centred care model allows a partnership to be created between the midwife and parents. By expanding the model to be family-centred in the NICU setting, this can support parents in adapting to their new role, helping them to cope with mental health issues, and guide them in positively influencing their baby's development.
Rural communities in Australia, which statistically experience poorer health overall, also have higher rates of preterm birth compared with metropolitan areas. These poor health outcomes are often the result of increased stresses in rural regions. Unfortunately, in Australia, there are only 23 neonatal intensive care units, with the majority of these being in metropolitan areas. And those few services that are available in remote locations tend to be generalist in nature. This can result in a lack of specialised knowledge to meet the complex needs of each child. In these circumstances, it is likely for the newborn to be transported to a larger hospital establishment via aircraft. Thus, the parents are separated from their baby, impairing the bond between mother and child. The destruction of this bond can then be exacerbated by the mother's negative psychological state, as emotional detachment and avoidance are common coping mechanisms for women of premature infants. These mothers will often withdraw themselves from the traumatic experience of being separated from their new baby in order to keep particular emotions and perceptions of themselves, such as guilt and anxiety, out of awareness. For a premature birth that occurs in an urban location, this emotional response may be visible in the mother's reserved body language, for example, not showing excitement at signs of the newborn's good health. However, for mothers who live in rural communities that are required to leave their baby at a distance from their home, the signs can become more extreme. These mothers may refuse to visit their newborn, using their remote location as a justification for their disassociation from the infant, and in extreme cases fabricating a psychological disbelief towards their young one's survival. This has a detrimental impact on the baby as it prevents the occurrence of bonding. As midwives, we play a crucial role in ensuring equitable resources are provided to those mothers living in rural and remote regions. By reassuring the mother and encouraging her to share her feelings, we can assist in supporting this uneasy transition to parenthood. These conversations should be open-ended so that the mother feels safe and welcomed. In doing this, the woman is able to build a trusting and friendly relationship with the midwife, which is extremely important for mothers who have travelled to an unfamiliar place in order to visit their baby. Midwives are also essential for guiding those mothers who do need a little extra support to the right services. As midwives, we have the ability to inform families with infants in the NICU of financial aid programs, such as the Isolated Patients Travel and Accommodation Assistance Scheme, which can minimise stress around the costly circumstances of travelling long distances to visit their newborn. There is also an abundance of reading material that midwives can recommend to rural families so that they do not feel so isolated in their NICU journey. The Life's Little Treasures Foundation Hospital Folder is an example of this, as it covers everything from shared stories to coping strategies and practical tips.
Indigenous women often face barriers with receiving culturally safe care. Postnatally, Indigenous women feel most comfortable surrounded by their kin. This expected cultural support is especially important for mothers as they are vulnerable to mental health issues such as depression, anxiety, and PTSD, due to the fear of losing her baby in the NICU. Maternity unit policies may be a barrier to postpartum support, as limits of 2 visitors postpartum prevents Indigenous women from feeling comfortable in a hospital environment and less anxious about a premature baby. Some Indigenous communities, such as those in Mildura, which is on Latchi Latchi land, have a welcome to country ceremony for the baby, which strengthens cultural identity that can be delayed due to a NICU admission. This can cause distress to the mother, as she may personally feel a disconnection with her baby or feel that her baby may be disconnected from her culture. Midwives must advocate for policy changes within hospitals to ensure mothers of babies in the NICU receive adequate cultural and emotional support. Additionally, midwives should work with Indigenous and other local health services to provide culturally safe care. First Nations women may hold distrust towards the Australian healthcare system due to a history of dispossession, mistreatment, and colonisation, as well as a preference for Indigenous medicines. This is a consequence of Western methods and medicines, historically and currently, being pressured on Indigenous women. The trust and familiarity felt in a continuity of care model allows for increased engagement with their baby's health and improved mental health. Midwives are aware of their cultural preferences and traditions and are able to assist new mothers to integrate these while the baby is in the NICU, thus providing a culturally safe experience. However, a review of the knowledge of cultural safety shows that it is still not prevalent amongst practicing midwives, who often view it as too difficult to implement, which then discourages them from learning. This leads to poorer mental health and lower perinatal satisfaction, as First Nations women may have a culturally unsafe experience. Thus, midwives must provide mothers with accurate information regarding health outcomes of premature newborns in order to reassure mothers of their baby's safety, without dismissing important cultural traditions, beliefs, and experiences. This support is essential in creating a positive postnatal experience and minimizing the impacts of postnatal depression in mothers of babies in the NICU.